Narcissistic personality disorder, often referred to as NPD, is frequently misunderstood. People toss the term narcissist around casually, using it to describe someone who seems vain or selfish. However, NPD is a complex mental health condition that goes far beyond simple arrogance. It affects a person's self-esteem, identity, and relationships, shaping how they see themselves and interact with the world. Individuals with NPD have a deep-seated need for admiration and crave a sense of importance. This need can drive them to manipulate and exploit others, often stemming from a fragile sense of self. They fear vulnerability and criticism, which can lead to a cycle of destructive behaviors. Understanding NPD requires looking beyond the surface and recognizing the underlying pain and vulnerability. Only then can we begin to address this complex disorder. In today's video, we will delve into NPD, exploring its prevalence, symptoms, causes, and impact on individuals and their relationships. We will also examine the diagnostic process, available treatments, and strategies for living with NPD. By getting a deeper understanding of this disorder, we can work towards greater compassion and support for those affected. Estimating the prevalence of NPD is challenging because many individuals with this disorder usually do not seek treatment. They may not even recognize their own behaviors as problematic. This underreporting makes it difficult to determine exact numbers. However, research suggests that narcissistic personality disorder affects a significant portion of the population. Current estimates indicate that between 0.5% and 5% of the U.S. population may have NPD. This means millions of individuals are likely living with this disorder. Understanding the symptoms of NPD is crucial for both diagnosis and treatment. The Diagnostic and Statistical Manual of Mental Disorders, known as the DSM-5-TR, outlines specific criteria for diagnosing NPD. These criteria include a grandiose sense of self-importance, fantasies of unlimited success and power, a belief in one's own uniqueness, a need for excessive admiration, a sense of entitlement, and a lack of empathy. Individuals with NPD often exploit others to achieve their own goals. They may be envious of others or believe that others envy them. They may also exhibit arrogant and haughty behaviors. These symptoms can significantly impair an individual's ability to form and maintain healthy relationships. Recognizing these signs is often the first step towards seeking help and beginning the journey of recovery. The exact causes of NPD remain elusive, as it is a complex disorder with no single root cause. Research suggests that a combination of genetic, environmental, and psychological factors contributes to its development. Genetics may play a role in predisposing individuals to NPD. Studies have shown that NPD is more common in those with a family history of the disorder, suggesting a genetic component may be involved. However, having a family history of NPD does not guarantee that an individual will develop the disorder. Environmental factors also play a significant role. Early childhood experiences, particularly those related to parenting styles, can influence the development of NPD. Overindulgent or overprotective parenting can contribute to a child's inflated sense of self. Conversely, neglectful or abusive parenting can lead to a child developing NPD as a coping mechanism to protect their fragile ego. Psychological factors such as temperament and personality traits also interact with genetic and environmental influences. For example, individuals with a naturally sensitive temperament may be more vulnerable to developing NPD if they experience negative childhood experiences. Understanding the complex interplay of these factors is crucial for developing effective treatments and prevention strategies. A narcissistic personality disorder rarely exists in isolation. It often co-occurs with other mental health conditions, leading to a complex web of challenges. Individuals with NPD are at an increased risk of developing mood disorders, such as depression and bipolar disorder. The constant need for validation and the fear of criticism can take a toll on their emotional well-being, leading to feelings of emptiness, hopelessness, and worthlessness. Anxiety disorders are also common among those with NPD. The pressure to maintain a perfect facade and the fear of exposure can trigger intense anxiety and worry. In some cases, NPD may overlap with other personality disorders, such as borderline personality disorder or antisocial personality disorder. This overlap can exacerbate symptoms and make diagnosis and treatment more challenging. Also, individuals with NPD may engage in risky behaviors as a way to cope with their emotional distress. This can include substance abuse, reckless driving, or engaging in dangerous sexual activities. These behaviors can have serious consequences for their physical health, relationships, and overall well-being. It's crucial to address these co-occurring conditions to effectively manage NPD and improve the individual's quality of life. Diagnosing narcissistic personality disorder requires a comprehensive assessment by a qualified mental health professional. There are no laboratory tests or brain imaging scans that can definitively diagnose NPD. Instead, diagnosis relies on a clinical interview and a thorough review of the individual's history and symptoms. A mental health professional, such as a psychiatrist or psychologist, will use the criteria outlined in the DSM-5 to make a diagnosis. They will ask the individual about their thoughts, feelings, and behaviors to determine if they meet the criteria for NPD. It's important to note that NPD often goes undiagnosed or misdiagnosed. This is partly due to the stigma associated with the disorder and the fact that individuals with NPD may not recognize their own behaviors as problematic. They may also be reluctant to seek help due to their fear of vulnerability and criticism. If you suspect that you or someone you know may have NPD, it's essential to seek professional help. A qualified mental health professional can provide an accurate diagnosis and recommend appropriate treatment options. Early diagnosis and treatment can significantly improve outcomes and reduce the impact of NPD on the individual's life. Treating narcissistic personality disorder involves psychotherapy to understand behaviors and develop healthier coping mechanisms. Medications can address symptoms like anxiety or depression. Effective therapies include dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT. DBT teaches emotion regulation and mindfulness, while CBT focuses on changing negative thought patterns. Schema therapy addresses deeply held beliefs from childhood. Therapy requires commitment and a skilled therapist. Living with narcissistic personality disorder is a journey of self-discovery and growth. Acknowledging the disorder and seeking professional help is the first step. Treatment provides tools to understand behaviors and develop healthier coping mechanisms. Building a strong support system is crucial. This includes friends, family, support groups, or online communities. Engaging in self-care practices is essential. Activities like exercise, meditation, and hobbies promote well-being. Celebrate progress and be patient with yourself. Recovery is a marathon, not a sprint. Focus on strengths, seek support, and commit to growth.